When you first look at our source for today, it just seems like a simple surgical lecture schedule. But if you look a little closer, you realize it's actually a treasure map. It reveals the incredible, intense path someone has to walk to become a surgeon.
So that brings up the big question, right? What does it really take to learn this craft, to get the knowledge you need to literally hold someone's life in your hands? Well, this schedule is our guide. So let's follow it and see exactly how a surgeon is built, right from the very first lecture. All right, here's our roadmap. We're going to start with the surgeon's foundation, then we'll take a tour through the core of the body. After that, we'll explore some specialized frontiers, meet the smallest patients, and see how surgeons rebuild the body. And finally, we'll step back and think about the mindset all this training creates. Okay, first up, the surgeon's foundation. This is ground zero. Before a surgeon can even dream of operating on a heart or a brain, they have to master the fundamental rules of the human body. These are the principles that apply to every single patient, no matter what. This whole foundation is really built on three core pillars. First, you have to understand how a body reacts to the massive stress of surgery or trauma. Second, you've got to know exactly how to fuel that body for recovery through nutrition. And third, you have to learn how to fight the most terrifying enemies a patient can face. These complex infections like necrotizing fasciitis, you've probably heard of it as flesh-eating bacteria, that requires immediate aggressive surgery. I mean, these are the absolute life or death basics. So once that foundation is set, the curriculum moves on, and next we get a tour of the torso, which is basically the body's engine room. This is where you start to get a real sense of the scale and the complexity that surgeons have to deal with every single day, from the lungs all the way down to the colon. And what's so wild about this part of the training is just the sheer density of it all. I mean, we're talking about one single area of the body, but it contains this entire universe of interconnected organs and a million potential problems, and a surgeon has to master all of it. Just take a look at this. This is pulled straight from the schedule. In the thoracic region, the chest, they have to master lung infections, pneumothorax, which, by the way, is a collapsed lung, and diseases of the esophagus. Then you move down to the upper abdomen, and they're tackling stomach tumors, gallbladder diseases, pancreatitis, liver disease. It just keeps going, all the way down to the colon and rectum. Every single line you see here, that's a distinct and unbelievably complex world all on its own. So now that we've seen the insane amount of knowledge it takes for just the core of the body, the curriculum starts to branch out into these specialized frontiers. It doesn't just stay in the torso. It dives deep into some of the most intricate, delicate systems in the entire human body, from our brains right down to our blood vessels. And this slide is a fantastic illustration of the different kinds of expertise they need. On one hand, you've got neurosurgery. You're managing the body's control center. We're talking head injuries, spinal cord damage, brain tumors. But then, on the other hand, you have vascular surgery, which is basically like being in charge of the body's plumbing. That means blocked arteries, bulging aneurysms, and major injuries to blood vessels. Two completely different and incredibly demanding fields of study. And believe me, the specialization doesn't stop there. The curriculum then pivots to another entire system, urology. Now surgeons in training have to master everything from infections and blockages to kidney stones and cancers of the bladder and prostate. And what this does is it just hammers home the point. To be a surgeon, you have to be an expert in so many different, massive fields of knowledge.
Okay, so now the curriculum takes a really profound turn, focusing on a completely different kind of challenge, pediatric surgery. This whole section of the training really drives home a crucial point in medicine. Kids are not just small adults. Their bodies are still developing, and that presents an entirely different set of surgical challenges. And that really gets to the heart of it, doesn't it? You're not just fixing a static problem. You are intervening in a system that is actively growing and changing. Every single decision, every little incision could have consequences that stretch out for an entire lifetime. So the focus shifts to problems that are really unique to childhood. Things like congenital malformations. Those are issues a child is born with. Plus specific causes of abdominal pain in kids, groin disorders like hernias, and sadly, the types of abdominal tumors that mostly affect children. Yeah, it's a completely separate world of surgical practice. All right, next up is our final clinical section. And this one is all about the art of restoration. Here, we're looking at orthopedics and plastic surgery, the disciplines that are all about rebuilding the body, restoring function, and literally putting people back together after an injury or disease. The common thread that ties all this together is reconstruction.
Whether it's learning the basic principles of plastic surgery or managing a catastrophic traumatic injury, the goal is always the same: to restore form and function, to give a patient their life and their mobility back.
This slide really shows you the journey for just one type of patient, someone with a major orthopedic trauma. It all starts with assessment. Then it moves to the core principles of how to fix fractures and dislocations. From there, it addresses potential complications like infection. And finally, it covers the entire spectrum of rehabilitation. It's a complete roadmap to recovery. So we've traveled through this entire curriculum. For our final section, let's kind of zoom out and just think about what this incredibly intense roadmap tells us about the mind of a surgeon and the sheer scale of their training. So when you add it all up, what do you get? You get this: 41. 41 distinct, incredibly complex topics packed into this one curriculum. And that isn't just a list, it's a staggering testament to the sheer volume of information a surgeon has to master and have ready to go at a moment's notice. In the end, this simple schedule is so much more than a list of topics. It really is a map of the human body, but it's also a blueprint for the unbelievable discipline required and a powerful testament to the level of dedication it takes to earn the privilege of holding a life in your hands. So, we've seen the map of all this knowledge, and it leaves us with one final and I think crucial question. What kind of person does it take to actually walk that path? To not just learn all this material, but to live it, mastering it with the resilience, the dedication, and the deep humanity that this profession demands. That's the real story hiding behind the schedule.